Hello, thank you for this opportunity. So as an epilepsy service, we work across two sites, one trust, at York Hospital and Scarborough Hospital. So really for us, the RCPCH EQIP gave us an opportunity to review our current service and make some positive changes. So as we've got that picture on at the moment, I just wanted to say some other quality improvements that were achieved that won't be focused on as much in this presentation. So Dr. Anthony Abbey and Dr. Ruchi Galachi, our York consultants, addressed the need for an epilepsy information database for our service. We're certainly not there yet, but we have gained access to enable active alerts on our trust database for children and young people with acute individualised epilepsy care plans. Joe Horrocks, who's our neurophysiology manager, started an ambitious review of the EEG department, but unfortunately due to COVID restrictions, that had to stop. Dr. Mazin Quinibi, our Scarborough consultant, engaged with our restricted local psychology service and secured monthly psychology peer supervision to discuss children and young people, thereby providing more holistic care. Joe Shaw, as our administrative coordinator for this project, basically kept us organised with our meetings and provided essential IT support. So as a team, we all agreed to progress with the Epilepsy Passport individual healthcare plan, which Jeanette Gowland, Jeanette Clark and myself as epilepsy nurses have continued to test. We'd also really like to thank the RCPCH, Epilepsy Action and Bucklam for their continued support. So as we've moved on to this, as you can see, the aim of our quality improvement project was to develop an epilepsy passport to communicate information with the aim of improving care for the child, young person with a diagnosis of epilepsy by June 2020. I'm not going to read all of those through because I know that we're a bit tight for time, but anything that people would like to see more of, I can easily share. So you can just see the primary and the secondary drivers there. Just pause on that a minute and then we can go to our next one. Yeah, thank you. So findings from a medical student project in 2016 showed that only 70% of families asked thought they held sufficient information about their child's epilepsy and that the information was shared appropriately. Only 20% thought that the current system was helpful to the child, young person, and only 30% thought that schools found the current communication useful. So when asked if an epilepsy passport individual healthcare plan would be an improvement, 80% strongly agreed it would help parents and carers, and 9% strongly agreed it would help the child, young person. So in the background, my colleagues and I have inherited an epilepsy service which consisted of a consultant and an epilepsy nurse who worked tirelessly 3 days a week at York Hospital, and at that time there was no epilepsy nurse at Scarborough Hospital. So we reviewed the findings and started to use an individual epilepsy care plan in accordance with NICE guidelines. So really, the RCPCH EQIP gave us a fresh opportunity to review their passport, and our initial review found the following. So we wanted to be able to use the passport, and we liked what we saw of it, but we just, when we went through it, reviewing it, we felt the text boxes were too small, and there wasn't enough space to give a full seizure description. We felt like, as you can see, the rescue medication instruction area was too small for those with more than one seizure that they would require it for. And we wanted to keep it concise, but just needed a bit more space really for more valuable parts such as emergency rescue medication. So early 2020, we continued to work through the PDSA cycle for our project, which meant engaging families, health professionals and receiving feedback from short break placements. Subsequent findings were that we needed to make the passport more child, young person friendly, incorporate a clear individual care plan specific to the child, young person, and just to create a passport we felt that was less generic, as in sort of less hospital based and more helpful to the child, young person in all of their settings. So for example, home, school, short breaks and hospital. And then as we all know, in March and April, COVID-19 restrictions meant that planned testing of the passport was clearly put on hold. However, coming together, appropriately distanced, in May 2020, with the input of a new senior manager, we were able to re-evaluate the current passport, again using the PDSA model. Being away from the project helped us to refocus, if we could just have the next slide, Yeah, thank you. There's to refocus, rethink and redesign. So again, just going through these, we looked and just felt like the language needed to be simplified, that extra space for seizure descriptions would help non-medical carers, and also just to give the child, young person that space to be able to, sort of give their experience of their epilepsy. And we felt that many of the non-essential parts, which we thought in terms of like dose of medication, possible side effects, that they weren't necessary in this passport. That it needed to be more child, young person friendly. We wanted to make it predominantly electronic document that could be emailed. And again, just like that contribution and support from the RC, PCH, Epilepsy Action and Buckalam, that it is a collaboration, I think, really. So if we get from this, the results of our 4th PDSA cycle was the design of a bespoke trust passport that was primarily a digital document with a focus on information useful to the child and young person. Permission was granted from Epilepsy Action and Buckalam to incorporate their information, which we're very grateful for. And the following slides represent our latest version. It is a working, still being worked on version of the York NHS Trust Epilepsy Passport Individual Healthcare Plan. So these will just come, yeah. So we have this one, which is the Epilepsy Passport, and then we have a second one, which is the Epilepsy Passport with emergency medication. So that one would have an extra sheet with it, or an extra page with it. And certainly, I know we're going through them, at a reasonable pace, but certainly we could share this with people who wanted to see more. And following on from that, there's also the advice of what to do for someone who has a generalised seizure or a focal seizure. And I think in terms of that information, if it was emailed, that's like a drop down that people would go on to. Certainly in a paper copy, that would be something that was printed out. And again, like we said before, the use of the Buckalam, because we felt that, again, these images, are really helpful to use. And it is theirs that we're using. All the children that we have within the York and Scarborough Hospital are using the Buckalam if they're on the Dazzlam. And so then to PowerPoint 10, we're just, as a team, we found this really useful, the CAS improvement model, just working through, and certainly we'd like to use it as an improvement tool as we continue to improve our epilepsy service. And the last slide really is our next steps. So we want to ensure that all individualised acute emergency seizure plans are accessible on the hospital alert system. That we really, for the passport, we want to be able to complete the formatting and clear with our clinical trust governance. We want to be able to roll out the epilepsy passport to all the children and young people to make it more child, young person friendly. And we do kind of feel like we'll be altering and improving it forever, but that's just good in terms of getting feedback from the families and schools and other stakeholders. So the medical information that was removed from the original passport is important, and we would like to be able to incorporate that into an electronic care record, which is another thing that Dr. Anthony Abbey and Dr. Galachi were really looking at with our trust. And with the support of IT, lastly, we'd like to update the Child Health Epilepsy Trust website. Thank you for listening.